Hello, learners. Welcome to the session. I am your Dr.G.M. Today, let me discuss about the physically challenged children and their education. Concept of physical challenge. A physically challenged person is defined as a person who has disability of locomotor and neurological organ which consist of disadvantages or restriction in one or more aspect of daily living activities. In other words, the challenged conditions may be temporary or permanent and mild or severe. Physically challenged children may be multiply handicapped with a mental challenged, visual or hearing impairment. Physical disability is most one of the opposite of the person's mobility. A person with physical disability may need to use some sort of equipment or assistance with mobility. People who are handicapped can still have a normal life. They may not be able to do what they like to do much less or regular activities like other. However, they are capable of being happy and productive. How will identify and recognize the physical handicapness? It is important to recognize that students with disability studying on the school have a variety of disability. When planning event and activity programs would consider many disability to accommodation issues. Remember, a person with a disability is not defined by their condition. Each person is unique, individual, but a good place to start an understanding of type of disability and their impact. A disability is functional limitation or restriction of an individual's ability to perform an activity, but that does not mean that a person with disability cannot participate equally. It is important to remember that the disabled is an adjective, not a noun. People, please do not condition. It is therefore the preferable not to use the term the disabled, but rather person with disability or the challenged. The type of physical and handicap, their causes and characteristics. A skeletal impairment. This includes joint movement limitations, small limbs, missing limbs, abnormal trunk size. Some major causes of this impairment can be explained as follows. Arthritics, Sandivata. This was defined as a pain joints, usually reducing range of motion and causing a weakness. Cerebral palsy. Cerebral palsy is defined as a damage of the motor area of the brain prior to brain maturity. CP is a type of injury, not a disease, and does not get worse over time. It is also not curable. A spinal cord injury. A spinal cord injury can result in a variety of varices. The extent of various in the parts of the body affected and determined by how high or low in the spine that damage occurs, the type of damage to the card. And head injury. A head injury is used to describe a wide array of injuries, including consciousness, brain trend injury, closed head injury, cerebral hemorrhage, describes broad in subsets, oxygen and fast functions. A stroke. These three main causes of stroke are thrombolysis, blood clot, blood vessels, blood clot, few at this point. Then spinal cord injury. Then the loss of this, a limb or finger. This may be due to trauma in a muscle surgery or etc. Usually, protections are known, though this do not result in full total function. Frankston's diseases. This is a progressive disease of the older adult, characterized by muscles rigidity, slowness and movement, and unique type of tremor. There is no actual practice. The use is the onset of 50 to 70, and this disease is relatively common. Educational provisions for physically handicapped children. Physically handicapped children long to be normal and to be seen normal, such as possible. Focus so that they can react or times. Find out what the child's strengths are, capitalize them. The children need to feel successful too. Keep your expectancy for physically challenged children high and child capable for achieving. Never accept rude remarks, name calling, teasing, and that the children sometimes, other than children, need to be taught about physical disabilities to develop respect and acceptance. Complacent appearance of the time to time. Delight when I need it. Here in your behavior and in your output. Make adjustment and accommodation whenever possible to enable them to child participate. Never pity and physically handicapped child. They do not want our pity. Take more opportunity when the child is absent. Teach the rest of this class about physical handicaps. This will help foster understanding and acceptance. In the conclusion, to conclude, we have to observe that physical disability is part of humanity. No one is victim of this choice. Therefore, we cannot use it as basis of discriminations to those that suffer from it. Instead, we should make effort on how we empower these few that are disadvantages as well as observe in a life. Indeed, disability is not inability. Thank you so much for your patience listening.